Our seminar today is on blood donation and transfusion, generally speaking, just transfusion medicine. So things that we'll cover are antigens and antibodies, just a brief little definition, just so you understand some of the things that we'll discuss today, canine and feline blood types, blood transfusion products, blood donor eligibility and exclusions, blood testing and mycoplasma, blood typing, blood donations, cross-matching, blood transfusions, and transfusion reactions. Now, I know it's a lot of information that we are putting into quite a small seminar. If you have any questions throughout, please just pop your hand up. We're happy to answer them as we go. But we put quite a lot of little detail in it, so hopefully it's easy to follow along.
Alrighty, let's get started. So one of the first topics we're going to discuss in this seminar are blood types and their compatibility with each other. But to have a better understanding of this, we need to have a basic understanding of antigens and antibodies. Simply put, antigens are a variety of substances recognized as foreign by the body. Your body will trigger an immune response. This immune response is your immune system creating antibodies specifically developed to fight that antigen in case your body is ever to encounter them again. An important distinction for this particular seminar is the use of the word alloantibodies. Now, alloantibodies are immune antibodies that are produced following exposure to foreign red blood cells.
So the first topic that we'll discuss is canine blood types. So canine blood groups are classified by the dog erythrocyte antigen system, which is referred to as DEA. These are the antigens that are attached to your red blood cells, or canine's red blood cells. The 6 DEA groups are DEA 1.1, DEA 1.2, DEA3, DEA4, DEA5, and DEA7, all of which are either positive or negative for the antigen, which will differ from canine to canine. DEA 1.1 blood types are the only one that we test for, and it's because it's the only antigen that would cause severe acute reactions if the patient were to receive the wrong blood type. All other mismatched antigens will only cause minor reactions and usually don't cause any harm to the patient. As pictured above, positive canines can safely donate to other positive canines, but their blood isn't compatible with negative canines, whereas negative canines are able to donate blood to both positive and negative canines. This is because positive canines carry the 1.1 antigen and negative canines don't. So if a negative canine is transfused with the blood from a positive canine, it's then being introduced to that 1.1 antigen, and if it already has alloantibodies, those antibodies will fight the red blood cells and destruction of all red blood cells within 12 hours.
Alrighty. The exception to this rule is if it's the recipient's first ever transfusion or within 3 days of ongoing transfusions. If this is the case, then it is safe to transfuse a negative canine with blood from a positive canine. This is because there is no naturally occurring alloantibodies to the DEA, so these antigens will not cause an acute reaction. It may cause a delayed hemolysis within 1 to 2 weeks, but by this stage, the patient will already hopefully be producing their own red blood cells. So the destruction of the transfused red blood cells won't have a large impact post-transfusion. However, if a negative recipient were to receive another positive transfusion 3 days and onwards, an acute hemolytic reaction would occur, causing the destruction of all red blood cells within 12 hours. This is because the canine develops an alloantibody to the 1.1 antigen. This type of reaction may clinically present moderate to severe, though is unlikely to be fatal.
Now, in addition to DEA blood types, there is a more newly discovered blood type that canines also carry called DAO. So DAO, like other blood types, typically wouldn't cause harm to the patient during a transfusion. However, Dalmatians are the only known breed that have a naturally occurring alloantibody to the DAO antigen. It just simply means that Dalmatians or Dalmatian crossbreeds should always be cross-matched before every blood transfusion, including their first one. Now, feline blood types. Unlike canines, felines do have naturally occurring alloantibodies, and incompatibility reactions can be moderate to severe depending on the type that the donor is and the type that the recipient is. There are 3 feline blood types. They are A, AB, and B. Generally speaking, A should only receive A, B should only receive B, and AB should only receive AB. If A were to receive B or AB, it would cause delayed hemolysis. The transfused red blood cells would be destroyed within about 24 hours. B can never receive A or AB blood. If B were to receive A or AB blood, it can actually become fatal within as little as 1 ml of blood transfused. If death did not occur, you would likely see fever, jaundice symptoms, and destruction of red blood cells within a 24-hour period at the least. AB is best transfused with AB, though they are a more rare blood type and finding donors can be quite difficult. It can acceptably be transfused with type A blood since the low amount of anti-B antibodies is unlikely to be harmful. Ideally, AB shouldn't receive B blood. There is a more higher frequency of anti-A antibodies. However, as long as cross-matching is done prior to any transfusion, AB can potentially receive both A and B blood. Now, unlike canines as well, felines, it's uncommon to get feline packed red blood cells. At least in Australia. They are used a bit more commonly overseas. If you are in a position where you do have access to that, it's important to know that AB is a universal recipient for A and B red blood cells only. This is because the donor's plasma has been removed, therefore the likeliness of antibodies being able to attack those red blood cells is minimised.
Alrighty, so we're going to talk about blood products now. Now we do have this expired blood bag that we're going to hand out just so you can all get a bit familiar with some whole blood. So in veterinary medicine, there are 3 types of products that we transfuse. They are whole blood, packed red blood cells, and plasma. We extract whole blood on site with local donors and we order packed cells externally. We can source these through companies that are dedicated to providing to vet clinics all over Australia. They do this by extracting blood from a negative canine and spinning it down via a centrifuge to separate, dispatch, and package. Now, whole blood is typically used for trauma patients, such as a hit by car or a dog attack. These patients have lost whole blood and are in need of more to replenish themselves. Whole blood is also used because it is readily available and it makes a great substitute for packed red blood cells. Packed red blood cells are used when you aren't wanting to stimulate the body's immune system. It's commonly used in patients with immune-mediated hemolytic anemia, which is IMHA, where your immune system is creating antibodies that attack your own red blood cells, or immune thrombocytopenia, which is ITP, where you have low platelets. Oops, sorry. Let me just go back. Now, plasma. Plasma is used for patients that are requiring clotting factors. This is seen where the patient has a coagulopathy, which is excessive clotting or excessive bleeding. For our example here, it is excessive bleeding. For example, of eating rat bait or getting bitten by a snake.
So becoming a blood donor. To become a blood donor, we have a basic eligibility criteria that needs to be met. The requirements that we have for canines are that they have a good temperament and that they're comfortable within a veterinary setting. We need them to weigh at least 25 kilos, be between the ages of 1 and 7, be up to date on all vaccinations and preventatives. They also need to be heartworm and mycoplasma negative, and just generally speaking, we need them to be in excellent health. Felines are very similar. We also ask they have a good temperament. We need their lean body weight to be 5 kilos and above. We do have quite some chunky cats out there, so making sure we still will meet that requirement, mine included. Be up to date on all those vaccinations and preventatives. They need to be FIV, FELV, and mycoplasma negative. Be between the ages of 1 and 7. We do require them to be an indoor-only cat, and like our canines, they just need to be in excellent health in general.
Alrighty, blood donor exclusions. These are some things that you'd exclude your animal from being a donor for, and that is if they have a serious health condition, if they've been recently sick with symptoms of vomiting, coughing, or diarrhea, if they've had a seizure, if they have or will have surgery within 4 weeks, if they've ever had a blood transfusion, Females, if they've ever been pregnant before, Dalmatian and Dalmatian crossbreeds, patients that are 8 years and older, if they are overweight or under the weight requirements, as well as if they are heartworm, FIV, FELV, or mycoplasma positive. We gather all of the eligibility information
Quick
by...
question at the back.
Yes.
Do you test the FIV?
It's
in-house or do you send it out?
So we do have in-house tests, yes. So they, I believe, you put it into a quick vet machine, the blood, and there are also snap tests.
Yeah, so we do them in-house currently. We are potentially looking at doing them externally and mixing it in with some of our like mycoplasma testing. But at the moment, we just normally use like a rapid test or a snap test, depending what we have in-house. If we don't have one in-house, we would definitely send it out to make sure we have those results.
So what happens if they're FIV vaccinated?
You can potentially get a false positive. If it did come through as positive and we did know that they were vaccinated, we would send one out of house and wait to see that result.
Cool.
So I'll just go over this eligibility bit again. We gather most of our information through questionnaires. The owners fill them out and return them to us. Based on the answers provided, we determine whether the animal meets our base criteria. We then organise a donor screening appointment, and this is where we do a physical exam. We do some blood typing, blood testing, and a urine screening.
So to determine the health of our applicant, so like Regan said, if they pass all of the questions on our questionnaires, which is just very basic, how old they are, how much they weigh, are they desexed, when were they vaccinated last, just everything that helps us kind of meet that first criteria that we mentioned. And then, we organise that pre-donation appointment. We have one of our lovely vets do a physical exam on the dog, and the cat, sorry. Generally speaking, we're just looking for no sign of infection, inflammation or disease. So we want to make sure there's no heart murmur, all of our chest sounds good, the skin looks normal, and we want those lymph nodes to be normal in size as well. Our standard blood screening protocol that we run for canines is just a hematology, biochemistry, PCV-TP, a blood smear. We do a canine blood typing kit. We test for heartworm, and we will send out-house an infectious PCR to test for mycoplasma. Felines are very similar. We just do the addition of T4 in our biochemistry testing. Obviously, we'll do a feline blood testing blood typing kit instead of a canine blood typing kit, and we'll test for FIV and FELV instead of heartworm. Now, some of you may not be familiar with the word mycoplasma, and you might be wondering what that is. So mycoplasma is a family of bacteria that can affect many parts of the body, can affect the skin, the lungs, the urinary tract. But for this particular seminar, what's important to know is that it can affect the blood. So depending on the strains contracted, if our canines were to have a strain called Hemocanus or our felines would have a strain called Hemophilus, it's basically a microscopic bacterial parasite that attaches itself to the surface of red blood cells. So for canines, it can severely affect immune-compromised dogs. It can lead to rapidly developing anemia or IMHA, which Regan mentioned a little bit earlier. And it's actually transmitted by the brown dog tick or by contact with infected blood, like receiving a blood transfusion with infected blood. Felines, it can cause severe regenerative anemia and occasionally non-regenerative anemia. It's transmitted via fleas for cats or with contact with infected blood, same way the canines are. It's vital that mycoplasma tests are completed and come back negative, as it would contaminate the blood and it would be transferred to the recipient. Overall, the successful candidate will be healthy on physical exam, have normal hematology and biochemistry results, needs to be negative for mycoplasma, heartworm, FIV, FELV, species dependent, and we also require them to have an appropriately concentrated urine of at least 1025. All of this testing should be repeated annually for all ongoing donors.
Righty, blood typing. When it comes to blood typing, there are two main ways of doing this. One is manually with a test card, as you can see above, and the other is via a quick vet machine. To manually test a canine or feline's blood, you will need to pop it in an EDTA tube. With these test cards, they have supplied diluent, the pipette, and stirrers. As you can see up here, this one is a canine. The green is for canine, and the red previously back here, is a canine, is a feline, So we'll just go through the steps. First of all, I'll go back to this one. Yes. So we have an agglutination well up the top here. And then, as you can see, a positive control well just here. I'm shaking. And a patient test. Alrighty. So I'll just go through the steps. This video goes quite fast. So if I start talking fast, I'm very sorry. So first of all, we're grabbing the diluent and popping it in the agglutination well, and then a drop of blood. We're then going to mix this for 10 seconds, but obviously this video is sped up, so it's a bit quicker. And then we're going to pop a drop of the diluent into the positive control and the patient test well, and then a drop of blood into each. Now, as you can see into the positive control well, that you can see agglutination will start to occur any second now. Now, this is normal for an A donor. Our patient test is down the bottom, so this will determine whether it is a positive or a negative donor. So if it is a positive, there will be agglutination down the bottom. As you can see, that's starting to occur. If it was a negative, it would look like the top agglutination well, which is also a negative. So in this slide here, we can see the interpretation guide, and as we can tell, our patient is a positive donor. Right, where are we at? Sorry. Yes.
Okay, so feline manual blood typing is much the same as the canine video that you would have just seen. Our wells are a little bit different. The top one is still an auto-agglutination well, but instead of having a positive control and a patient test well, we've got a type A well and a type B well. In regards to the actual test itself, everything is exactly the same, except there's one additional step. Once you have mixed your diluent and blood in the bottom two wells, you add one additional drop of diluent into well A only, and we don't stir this one in. We just leave that there and continue just to rotate our wrist until we kind of see that agglutination. And the agglutination will determine what the blood type of our cat is. So if it just happens in type A, then your cat is a type A. If it just happens in the type B well, your cat is a type B. And if it happens like the example up the top there, where there is agglutination in both type A and type B, your cat is an AB blood type. Now, to blood type a canine with a quick vet machine, I'm not sure how many GP clinics have them out there. I know I've been with a few. That is what we use at North Coast. I'm sure there's some other options out there, but for our presentation today, we will talk about a quick vet machine. So what you will need is just your quick vet cartridge, a diluent dropper, mixing vial, and pipette, all of which will be supplied in your packets. And then in addition, you need your patient's blood in an EDTA tube, and ideally a pipette with a fixed volume of 100 microliters. Felines are very similar. Again, you need your quick vet cartridge. You'll have a diluent tube instead of a diluent dropper for your felines, and your pipette tip, which is all included. And then again, patient's blood in your EDTA tube and that pipette with a fixed volume. Now, so in advance, what you also need for both canine and feline is to know what their current PCV is. So their current PCV will determine blood and diluent volume overall. So basically, you want to follow the steps. It is very easy to follow, but you just want to insert the cartridge when it tells you, enter all of the details it asks for. One of the first questions it'll ask is for the hematocrit of your patient. That is it asking for your patient's PCV. Once you've entered that for canines, the analyzer will determine how many drops of diluent you'll need. So it'll appear on the screen. It might say you need 3 drops of diluent. You'll have your little mixing vial, drop your 3 drops in there, and then you'll add your 100 microliters of blood into that same vial. Use the pipette, aspirate it a couple of times just to mix it thoroughly. And then when the analyzer requests it, you want to put 100 microliters total of your mixed blood and diluent into the little sample well on the cartridge. And after roughly 5 minutes, it'll display your result of either positive or negative. Feline blood typing with your quick vet machines are almost identical. Instead of the diluent amount being dependent on your patient's PCV, it's actually the blood amount. So as I would have mentioned before, you have a diluent vial instead of a diluent dropper for your felines. So your diluent amount is set. That does not change. So once you've entered your patient's PCV, the machine will ask you to add your patient's blood in increments of 100 microliters, depending on what that PCV is. So once you add that in, aspirate it the same as you normally would. Put the 100 microliters of the mixed sample in the well, and again, after about 5 minutes, you'll have a result that'll either say A, B, or AB, depending on what it is. Okay, so the next thing we're going to talk about is something called CPDA. So that stands for citrate, phosphate, dextrose, and adenine, which is referred to as CPDA. It's an anticoagulant and preservative for blood storage. Although there are many anticoagulant products that could be used, citrate is preferred for blood storage because of its safety, effectiveness, and longevity. So the ratio of CPDA is 1 ml of CPDA to 5 to 7 mils of whole blood. The consequences of having too high amount of CPDA ratio is it can cause hypocalcemia, so low calcium, in your patient, and in severe cases it can actually cause a coagulopathy. So it can prevent them from clotting their own blood.
Alrighty, the first, with preparing for blood donations. So the first thing that you need to prepare for a blood donation is to run their full panel in-house. So this must include hematology, biochemistry, a PCV-TP, and a blood smear. It is protocol the blood panels are run prior to every single blood donation. This is to ensure for illness or disease. You also want to have an IV in place just for sedation and post-op fluid therapy. After this, you can then set up for your donation and a patient's recovery cage. It's relatively simple to set up. We have pre-made donation kits that include a lot of what we have here. So first of all, we have our fluid therapy stuff just in the corner, and then our blood bag supplying the CBDA. We then have some gloves and some clipping and prepping items for a surgical prep, as well as some bandaging items, sterile gloves, some creams in case of any hematoma buildup or some skin irritation, as well as clamping and stripping the line items and scales. You will then need to calculate how much blood you'll be extracting from each donor. So to calculate these products, they vary between canines and felines. For canines, the calculation we use is 90 by their lean body weight multiplied by 0.2. For example, here we have a 25 kilo dog, so we're multiplying 90 by 25 and then multiplying that again by 0.2. So first of all, we're getting the 2,250 and multiplying that by the 0.2, which is the 20%, to get 450 mils as their total volume that can be extracted. The blood bags we used are pre-filled with CBDA. We can accommodate 450 mils to 500 mils in each bag. With this being said, we generally know as a rule of thumb that dogs that weigh 25 kilos to 27.7 kilos can donate up to 450 mils. And then if they exceed the 27.8 kilo mark, they can then donate a full 500 mils of blood into each bag.
So for felines, the calculation is very similar. It is 70 by their lean body weight with that amount multiplied by 0.2. So we have an example of a 5 kilo cat, which is our minimum for our cats. So we've got 70 multiplied by 5, which brings us to 350. We then multiply that number by 0.2 to get our total of 70 mils maximum that we could extract from that cat. This is where the donation procedure is a little different from canines. So since felines will only ever be able to donate such a small portion of blood, we don't actually have an appropriate sized blood donation bag where we can take that donation and actually store it in-house. So this means that we actually have to do the donation on the day that it's required for transfusion. So using that CPDA calculation that I mentioned in a few slides before, it's 1 ml of CPDA to 5 to 7 ml of whole blood. So we know that we're going to require 10 to 14 ml of CPDA for the 5 kilo cat in the example. We can get this by aseptically pouring CPDA from our canine blood donor bags into multiple 10 to 20 ml syringes, making sure that you evenly distribute that CPDA depending on how much blood you intend on extracting into that particular syringe to make sure your ratio is correct. Finally, you'll want to have your sedation drawn up and ready to administer. Generally speaking, we donate our canines with 0.2 mg per kg of butorphanol and 2 micrograms per kilo of medetomidine. Our felines, very similar, 0.2 mg per kg of butorphanol alone, and then we'll induce them with either alfaxan or propofol, depending on the cat. Protocols will differ from donor to donor and even hospital to hospital, but this is our current protocol at North Coast Vet Specialists.
Alrighty, how to perform a blood donation. Once the blood smears and bloods have all been approved by your clinician and you're all set up and ready to go for your blood draw, you can ensure you have 2 procedure nurses and a phlebotomist. Firstly, placing the patient in a lateral recumbency and clipping a square patch around the jugular. You can then do a surgical prep on the site using chlorhexidine and a SurgiPrep disinfectant, allowing 3-minute contact time. Though the donation is not a sterile procedure, it is important to treat it as such and work aseptically. The phlebotomist must wear surgical gloves and prevent contamination of the prep site while sticking the jugular. The phlebotomist uses one hand to raise the jugular vein in gentle pressure in the thoracic inlet and work. Oh, sorry, where am I? Thank you. They must then line up the needle with the patient's head or towards the patient's heart at a 10 to 20 degree angle. A successful venipuncture is indicated by flashback of blood into the tubing. During the donation, the needle needs to be 1.5 centimetres within the vein to guard against any dislodgement. Ensuring the blood bag is below the patient to allow gravity to fall into it. The bag is then closely monitored for expansion, weight increase, and agitated every 30 seconds by the procedure nurse for an even distribution of blood to CBDA. If the blood flow does not resume during the site, it needs to be monitored for any hematoma formation, and then you can slowly reattempt advancing the needle or rotating the needle. The phlebotomist must stay in this position until the desired amount of whole blood has been extracted from the donor.
So moving on to feline donation. So unlike canines, all of our feline donations are done under a full general anaesthetic. So to do this, you'll need an anaesthetist and 2 procedure nurses. The anaesthetist, as it sounds, is in charge of the anaesthetic. And the role of the procedure nurses is for one to act as the phlebotomist and the other to actually be drawing the blood into the syringe, your pre-filled syringes with that CPDA. They also need to ensure, your second procedure nurse, that they are slightly agitating those syringes, again, just mixing the whole blood and CPDA throughout the actual extraction. To prepare for a feline donation, you'll require a 21 gauge butterfly needle, syringes filled with your ratio of 1 ml of CPDA to 5 to 7 ml of whole blood that you're expecting to put into that particular syringe. And once the patient is stable and your anaesthetist is happy with your donor's anaesthetic plane, you can commence clipping and prepping the area. Like canines, you want to clip a large square around the jugular and do a surgical prep around the site. The same venipuncture principles apply. Once the needle is placed into the jugular vein, you want to gently draw back on the syringe until you get a flash of blood within the butterfly needle's tubing. You want to try to make sure to avoid any negative pressure while doing so, as you'll see visualized in the video above. Very gentle on the syringe, and the blood will slowly fill in. And probably hard to see from there, but there is already CPDA in that syringe. After the syringe is filled to the desired amount, the procedure nurse will need to aseptically remove the blood-filled syringe and replace it with a new one containing CPDA. This is best done with the assistance of the anaesthesia nurse. Just to prevent blood spillage or contamination, we need to keep it as aseptic as possible, and that step will need to be repeated multiple times until you've extracted the desired amount of blood from your cat.
Once the donations are complete, you can place some clean dry swabs on the venipuncture site with some soft band and some swabs placed gently around the patient's neck just to prevent any hematoma formation. Ensure with felines that you're placing a small vet wrap and small soft band around the neck just to approve discomfort upon wake up, as well as a less stressful bandage removal. The patient is then moved into their recovery cage and monitored closely.
So stripping and clamping the line. So using a line stripper, as you'll see pictured above, you want to draw the blood from the top, like the end of the line, basically where your needle was that was inserted into the patient, and you want to draw that towards the bag. So a line stripper allows complete evacuation of the blood from the tubing. You do, however, want to leave about 2 mils of blood, if you can just highlight that, Regan, in the line, and using clamps just to isolate that blood, so that way you're able to remove it without actually contaminating the bag. This is so the blood is easily accessible for cross-matching. It's best to leave fewer of these samples in case you have an incompatible cross-match and you require further samples for the same bag. Labeling and storing blood. So after completing the donation, the blood bag needs to be labelled with the following information. So you need to have the donor's full name, the date of collection, the expiry date, what the donor's blood type is. You need to know what type of blood is in that specific bag, the donor's current PCV, and the volume of blood extracted. As Regan said, it can accommodate 450 to 500 mils. We need to know exactly how much is in that bag. For felines, you want to have a sticker with the same information placed on every syringe of blood that you draw blood into. The exception for this is that the expiry date will be 24 hours, and you want to write down the amount of CPDA that's in that syringe as well. Those products must then be immediately placed into a fridge, preferably one designated for blood storage, just so it's not going to be exposed to constant temperature changes as it would if it were in, say, a lab fridge or a pharmacy fridge. And ongoing maintenance is quite simple. The bag just needs to be agitated once every 24 hours until it's used or disposed of when it expires. Same for the syringes. Once a blood bag has been spiked or drawn up into a syringe, it's only usable for 24 hours if it's kept in the fridge or 4 hours at room temperature. It must be discarded off after that point.
Righty. Is there any questions going off blood donations?
You said that you pull a sample for cross-matching. Where do you pull the sample from?
So if we go back, I don't know if you can see these very well. So we've clamped off samples on the line, so you can actually remove those samples from the line, but the bag itself will still be clamped at the end. So you're not contaminating the bag, but you've got that exact sample of blood within the tubing. It's not very well pictured.
Stick the tube.
No, you can usually, it's not very well pictured, but next to that clamp, there's like a small amount of tubing without the blood. You can literally cut it off and you've got a sample ready to go. Yeah. Anything else before we move on? Great.
Righty. Complications with donations. If a hematoma develops or the needle becomes dislodged, the blood collection will need to be discontinued and a new venipuncture site must be selected. Gold standard would be to dispose of the current donated blood, assuming the donor was still able to donate a full unit of blood without exceeding their limit. If this is not possible, you are able to calculate how much further the blood donor is able to donate and remove the excess cbda from the bag. Alternatively, if these options aren't viable, you are able to select a new venipuncture site using the same needle as long as there is no contamination and you've avoided anything to do with cross-contamination,
So recovery and discharge. Seeing as though our canine patients do only receive that light sedation we mentioned before, they're actually usually up and walking by the end of the donation and we don't actually need to reverse them. Felines, on the other hand, are recovered like any other low-risk anaesthetic. So once you pop them back in their cage, both patients, canine and feline, they're just observed for kind of 15 to 30 minutes post-donation, just for kind of weakness, pale gums, weak pulses, and any other signs of hypertension or low blood pressure. They're also treated with intravenous fluid therapy just for the Hartmann solution as a volume replacement to treat hypovolemia, which is just low fluid volume due to the donation. We do this at a rate of 2 to 3 times the amount of blood we've extracted. So if they donate the full 500 mils, we're going to give them kind of 1 to 1.5 litres of fluid replacement over like a 4-hour period. Generally, we like to extend that time out. Before discharge, we'll obviously remove that neck wrap and just check the jugular venipuncture site for any hematoma formation or any other complications that you notice. And then they can be sent home that same afternoon. Every donor will get sent home with a bandana. We give them a little goodie bag of food and normally a treat bag as well, just to say thank you. Even though, our donors can donate up to every 4 weeks as long as they're fed a nutritional and balanced diet, preferably not a raw diet. However, our feline donors can donate as early as 2 weeks in a case of an emergency, as long as their blood work is good. Now, even though they can technically donate this frequently, we do try to have donation gaps of at least 3 months between our donors. This is just for their safety and to prevent creating like a negative association with the vet clinic. We want them to enjoy coming to us, and if they're coming to us every month, they're probably going to get tired of it. You can only give so many treats to avoid that.
Now we're going into cross-matching. So cross-matching determines whether the donor's blood is compatible or incompatible with the recipient's blood. A cross-match is performed prior to administration of a blood transfusion. The purpose of cross-matching is to detect the presence of alloantibodies in the recipient's blood against the red blood cells of the donor's blood. An incompatible transfusion can result in a severe reaction. There are 2 types of cross-match methods. They are known as a major cross-match and a minor cross-match. The major cross-match tests the compatibility of the recipient's plasma to the donor's red blood cells. This will essentially show you if there will be an immediate transfusion reaction. Where am I? Transfusion reaction. Whereas a minor cross-match is determined to test the opposite compatibility, which is the donor's plasma with the recipient's red blood cells. This will determine whether there will be a delayed reaction.
Major and minor cross-matches can be done manually by cell washing and incubating samples to test compatibility. This is quite a long process and there are some pre-made kits out there that will make it a lot easier and less time-consuming. But basically a major cross-match is a method that you will always use whenever you cross-match. However, if your patient has reoccurring anemia or is needing ongoing transfusions, it is ideal that you do both a major and a minor, just to prevent this being an ongoing problem. If there is agglutination during a major cross-match, this indicates that the cross-match is incompatible and the donor should not be used for this particular recipient. Whereas if there's agglutination for during a minor cross-match, it is preferable that washed or packed red blood cells from this donor would be administered over whole blood. This is to eliminate any likelihood of antibodies from the donor affecting the recipient's red blood cells during transfusion.
When to cross-match. So generally speaking, canines need to be cross-matched from 3 days after their first transfusion if they're ongoing or if it's their second transfusion. The exception to this rule is Dalmatians, who must be cross-matched before every transfusion as they have a naturally occurring alloantibodies to the DAL antigen. Also canines that have been pregnant before, as there is a chance that they may have alloantibodies from the stud's DNA during pregnancy. Felines must be cross-matched before every single transfusion as they have naturally occurring alloantibodies to the blood types that require a rapid destruction of transfused cells. Preparing for a blood transfusion. When preparing for a blood transfusion, you can start by removing the blood from the fridge or freezer. If you are using fresh frozen plasma, it needs to be defrosted in water no warmer than 40 degrees. Although whole blood and packed cells doesn't need to be warmed before administration, it will gradually warm to room temperature while you're setting up and as it's being transfused. Excessive warming can decrease the red blood cells' viability and increase the risk of microbial growth. You can get the following equipment ready for the transfusions. A CRI pump or infusion pump, a giving set and extension set. A filter is placed on here, as well as this infusion set is placed with a filter as well inbuilt, as well as a chart here. So the chart will show a TPR, the capillary refill times, mucous membranes, a blood pressure, SpO2, and monitoring every 5 minutes, gradually building to the 15 minutes as the transfusion continues. The patient will need to have an IV catheter set in place at least 22 gauge or below to prevent from the lysing of the red blood cells. When calculating the blood volume, you ask your clinician for the patient's desired PCV. The ideal PCV for large dogs is 25 kilos, and for cats and small dogs, it's 30 for the PCV. You can then subtract the patient's current PCV by the desired PCV and multiply that answer by 2 for whole blood or 1 for packed cells. With that answer, you then multiply the animal's body weight, and then that will get your total blood volume to be transfused. For example, here we have a 33 kilo dog needing whole blood to be transfused. So we're getting their desired PCV of 25, and we're subtracting that by 12 as their current PCV. That equals to 13. We're then timesing that by 2 for whole blood to get 26 mils, and then we're multiplying by 33 as their body weight to have a total infused volume of 858 mils. In this next example, it's exactly the same, but instead of the whole blood to be transfused, we are doing the packed cells, which we're multiplying by 1 instead, which gets you to 13 mils, and multiply that again by the body weight to get you 429 mils to be transfused. We then have puppies and kittens. We are going through, this is a different example here, but it's pretty much exactly the same. We're getting their total adult volume to be transfused and multiplying that by 1.25. So in this example, we have a 6 kilo puppy. We've got their desired PCV of 30 by their current PCV, which gets you to 18, and we're timesing that by 2 for whole blood to get 36 mils by a 6 kilo dog. Which gets it to 216 mils as their total adult, and then we're then multiplying that again by 1.25 to get 270 mils to be transfused. This is because puppies and kittens have a higher blood volume compared to an adult canine dog, or kitten, sorry. Unlike other blood products, plasma gets calculated at 10 mils per kilo rather than doing this example on the board.
Okay, so giving a blood transfusion. So giving a blood transfusion is similar to any other intravenous fluid therapy. The main difference is that we use an IV vet infusion pump or any other pump that's specifically designed for transfusing blood products, and you must use a giving set with an inbuilt filter. If you're giving the transfusion with a CRI pump and your syringes of blood and CPDA, you need to make sure you're using an inline filter that's attached to your syringe. That'll then be attached to an extension line and connected to your patient. Your inline filter will need to be replaced for every 60 mils of transfused blood. The use of filters in blood transfusions is extremely important as it's designed to remove clots, platelet aggregates, and fats to prevent them from being transfused to the recipient. To minimise the risk of bacterial growth in red blood cell and plasma products, the transfusion needs to be completed within 4 hours. This can slightly vary if you have a patient or a case that, say, has a severe heart murmur and you are really worried about fluid overload with the amount of blood that you're transfusing in that 4-hour period. You are welcome to take the blood over, say, various syringes, or draw it, spike your blood bag and put them into syringes. That way you can keep some of the blood in the fridge longer than others to extend out that 4-hour period, just to make sure that each individual syringe is not at room temperature longer than 4 hours. Transfusion rates on blood products are pretty similar to one another. Your whole blood is 1 to 10 mils per kilo per hour, or up to 22 mils per kilo per hour. That rate is generally reserved for your emergencies and critical patients, so that's quite a high rate. We always start at 1 mil per kilo per hour for the first 15 minutes or so, and then we'll slowly increase that until we reach our desired rate. For packed red blood cells, it's essentially the same. We've got our 1 to 10 mils per kilo per hour. Instead of starting at 1 mil per kilo per hour, we do start at 0.25 mils per kilo per hour for that 15 to 30 minute mark, and then again slowly increase that until you reach your desired rate. And our plasma is 1 to 10 mils per kilo per hour, starting at 1 mil per kilo per hour and gradually increasing.
Transfusion reactions. They are often categorized as immunologic and non-immunologic reactions. Immunologic reactions are caused by pre-existing antibodies against the red blood cells with symptoms of pyrexia, tachypnea, tachycardia, tremors, seizures, hypertension, cardiac arrest, facial swelling, as you can see here, dyspnea, and a dramatic drop in PCV. Non-immunologic reactions can be caused from bacterial contamination into the bag, too small of a catheter being used, mishandling or improper citrate ratio within the bag. The most severe and life-threatening cases usually occur during the first 15 minutes of transfusing. These reactions can be as delayed as 2 days to 3 weeks. It's important to note that a temperature spike is usually the first sign of a transfusion reaction. Most signs of delayed reactions are decreased appetite, anemia, thrombocytopenia, and jaundice. What to do if a reaction starts? If a reaction starts, you are to stop the transfusion and inform the vet immediately. And based on the reaction, the vet can decide a course of action, whether to treat the reaction, the reaction, or whether to discontinue the transfusion.
So that is essentially the end of our seminar. Does anyone have any questions before we go over a couple of other things?
No questions?
Lovely. Okay. That's okay. If you come up with any questions soon, we've got our email listed in a moment that you can obviously, yes.
Can you talk about like the DEA? So does that represent anything in particular, or is that just?
So the DEA is just the acronym for the dog erythrocyte antigen. So that's just what it stands for. So the 1.1 that we refer to, there is a few of them, but the only one we test for is 1.1 because that's the one that will cause like severe acute reactions if it's mismatched. Does that make sense? Yeah. Well, we'd love to thank everyone for coming out tonight to listen to our seminar. We are still currently trying to grow our canine and feline blood donor program. So if you or anyone you know would be interested in having your furry friend join our life-saving program, please come up and see us at the end. We'll grab an email off you and we'll send you out a little questionnaire or answer any questions that you might have that we didn't cover about donors specifically in the seminar.
We would also like to thank all of our medicine clinicians for their knowledge and guidance during the production of producing this seminar. We also have listed a lot of textbooks and our references. They're just up there if you're wanting to go search them up later. But thank you everyone for coming down.
Well done.
That's so yeah, any questions you may think of after you've left, feel free to send us through an email. Any feedback you have as well would be greatly appreciated. And any suggestions, if there's anything that you're particularly interested in when it comes to referral medicine, anything you'd like to know more about, let us know, because we're going to continue doing these nurse seminars, and we're happy to kind of cover anything that you're interested in learning.
Yay.